My name is Elizabeth Bastias-Butler, and I'm currently the Director of Clinical Services. We see patients through all stages of pregnancy up until 31 weeks and 6 days. Generally, patients are coming to us for terminating for fetal anomalies, health conditions of the pregnant person, but also people who, because of barriers that have been put in place by legislation in their states, can't access the procedure earlier in pregnancy. So you have people who are 8 weeks and 7 weeks pregnant who no longer qualify to receive the procedure in Texas. They're frantically calling around to other clinics, but then when they find out the cost of the procedure and having to travel so far out of state, it takes time for them to raise funds. And generally how it works is they'll call one of the clinics, and clinics will tell them to get in touch with certain funding organizations to make sure that that gets covered. But they might also need to arrange for childcare, taking off work. So there are many layers that sort of draw out that process. So we also see patients who come to us really frustrated and exhausted. They know that they want to have an abortion. They know that they can't parent at the present time. Maybe they're already a parent. For our fetal anomaly patients, we're actually seeing a lot more of those later in pregnancy as well. A lot of places like Tennessee and Kentucky, where patients could have gotten procedures to terminate for fetal anomalies in state hospitals or other hospitals in that state, are no longer able to do so because of legislative changes. So they're already grieving a very much desired pregnancy, and now they have to travel from Kentucky or Tennessee or elsewhere to DC for a 2 to 3 day procedure. So it's a really difficult decision that they make, but we trust our patients that they're making the best decisions for themselves and their families and their futures.